Good evening, everyone. I'm Dr. Sara Shaikh. I'm MRCOG Part 1 mentor with MedPrep Online. And today we are conducting a very important session on how to prepare for MRCOG Part 1. So we'll be covering everything right from how to book the exam, what the exam format is, how to prepare for the exam, and what books to refer. So we'll begin our webinar. Okay, so on today's agenda, we have why should you take the MRCOG Part 1 exam? What are the prerequisites before any of your preparation? How do you actually prepare for the Part 1? What are the common reasons why students fail and how to make it in one go? How to successfully clear your exam in the first attempt? So we'll tackle these one by one. So first and foremost, what is the MRCOG exam? So the MRCOG exam, which is conducted by the Royal College of Obstetricians and Gynecologists in UK, is a very prestigious degree which is awarded to the ones who who clear the exam. This can be either your MBBS graduates or ones who have finished their training in obstetrics and gynecology. So this is for students who are studying in UK as well as for international candidates. So why is it important to clear this exam? First and foremost, the exam is a standard which is set according to the Royal College of Obstetricians and Gynecologists, and it is recognized worldwide, right? So once you appear for these exams and you study the exam guidelines, you will realize that your competency level is definitely increased. The way you handle your clinical cases, your patients, your practice, your management, your knowledge, and overall academics is improved, right? So it grants you a leadership in medical education. Additionally, it's a very prestigious degree. It's a globally recognized qualification, not just in United Kingdom, but also in other countries worldwide, and it gives you a higher credibility. So now, what are the prerequisites for the Part 1 examination? So first and foremost, what you should know is that the Part 1 examination is conducted twice a year. So one session is usually in January, the other is in July. So first and foremost, you log on to their website, which is the RCOG official website, right? And you have to register. You have to create a new account. Once your account is created, you have to fulfill all of their eligibility criteria. Once the eligibility form and assessment is done, which usually takes around 4 to 8 weeks for approval, the exam dates will be announced and you can fill the form for the expression of interest. So to take the RCOG exams, first and foremost, you should have an RCOG account. If you're already booked or you have taken the RCOG exam, you have an account. So use the existing account. Do not log in or create a new account because all of your information will be stored in the same place. If you are a beginner and you are starting for the first time and you don't have an RCOG account, you create a new account by clicking on registration, which is at the top of your screen. So it's a very simplified process once you go onto the RCOG website. Now, how do you submit your application? So the eligibility assessment application will be given by, once you register, you'll be given a college number. So you have to compose a new email and write the subject as Part 1 eligibility assessment application and insert your college number. You have to attach the completed form, which you can fill online and digitally attach your signature, as well as attaching a copy of your original primary medical degree certificate. This means your MBBS degree, your medical degree from whichever country you have obtained it from. A scanned photocopy of the original has to be uploaded online, as well as your medical registration certificate, right? So this which is granted by your medical degree or university. Next, you have to send your email to the given email ID and you will be receiving a response. Now, this is what the form looks like. So you'll be given an RCOG college account number. You will have to list your personal details. You will have to list all of your medical qualifications. Along with that, you have to give in your personal details like your ethnicity, your nationality, as well as the details as follows. If you are registered in GMC, that is from UK, then you do not need to send them your medical degree certificate. But for anyone who is a non-GMC registered, then you have to attach your degree certificate as well as your medical registration certificate. And always make sure that all of your qualifications, all of your important documents are certificates that are in English. So they have to be translated in English and then uploaded. Now, you have to know one thing, that RCOG pay structure is according to the bands that the countries have been segregated into different bands. So usually India and Pakistan, you'll see them in band B. So here you have been given the pay structure for each, but there's been a new update that for January 2025, the GST was mandated by the Indian Tax Authority. So for MRCOG Part 1 as well as Part 2, for candidates who are appearing from the country India, they have to give an additional 103 pounds to the standard, right? So this has increased the fees for MRCOG Part 1 and Part 2 for Indian candidates. Now, what are the important dates that you should remember for these? That July 2025, which is the exam will be on the 1st of July. The eligibility deadline will be up till 11th of March 2025, right? So once you have to fill your eligibility criteria, you have to wait for at least a couple of months, maybe, for your eligibility to get approved. So always make sure that your eligibility criteria is done and dusted, the first and foremost thing in your preparation, right? So once that is done and you receive, you're being verified by the RCOG, then you have to wait for the booking window to start. Now, the booking window opening will be from the 22nd of April and it will close by 3rd of June. And your exam will be on the 1st of July 2025. And the results are usually released within a month. That is, by 30th July 2025, the results can be expected. Now, coming to the main crux of our webinar, how do you prepare for MRCOG Part 1? So this exam format, it's a computer-based examination and the language of the exam is in English. So you have 2 exam papers and each exam paper consists of 100 single best answer questions. Single best answer questions basically is a question which is divided into 2 parts. So you have a lead question as well as the STEM. So you have a clinical scenario and then after that you have the lead question, which is basically asking you the next best management or clinical management or the next best investigation, following which you have 5 options. So any of the options may be correct or all options may be correct to the pertaining scenario, but you have to pick the single best answer which is best suited to your question or your clinical scenario or win it. Now next, you have to remember that Part 1 MRCOG exam has to be cleared. So it is mandatory for you to clear Part 1 to be eligible for MRCOG Part 2 exam. Now, this is a prototype of a single best answer question. So anyone who's online can attempt this question. Yes. Amara, Arika, Mariam, anyone? Anyone can unmute themselves and read this question. Yes, this is just a sample prototype. It's okay if you can't even answer if you can't give me the correct answer. Just want to see how you'll attempt the question. Okay, so I'll read it out to you and I'll show you step-by-step process on how this SBAs are attempted, right? So you have a 62-year-old who is taking tamoxifen following surgery for breast cancer. She is experiencing some vaginal bleeding and a transvaginal sonography measures her endometrial thickness as 7 millimeter. So how should she be investigated next? So pay close attention to what the SBA is actually trying to ask you. They're asking you here, what is the next best investigation after her transvaginal sonography? So the options given are as follows. Just a moment. So see, in this MCQ, what they're asking is the next best investigation. So here, because the patient is been on tamoxifen following surgery for breast cancer, what you have to know is that tamoxifen, it is a selective estrogen receptor modulator. So what it does is it has a propensity to increase the endometrial thickness, and this may lead eventually to dysplasia and cause cancer. So in such a case, this becomes a high-risk patient, and you would want to do a pipple endometrial biopsy. Yes, can be done, but in this case, the best correct answer would be to do a hysteroscopy and a targeted biopsy so as to not miss out on any invasive cancer, right? So the correct answer in this case would be answer B. Now the next question, this is a clinical case scenario. It's a 32-year-old who presents at 28 weeks of gestation and is feeling unwell with backache, chills, and rigors. She has a temperature of 39.5 degrees Celsius and the urine analysis shows leukocytes as well as presence of 3+ protein. Her blood pressure is now 84 by 50 millimeters of mercury. So what is the most appropriate action? So mind you, in this question, the lead question is, what is the most appropriate action? So first is to arrange for renal tract USG. The second option is to start the patient on 7 days of oral course of antibiotics. The third option is to admit the patient to ICU or HDU for intravenous antibiotics and supportive care. The next is to either give an intramuscular steroid to promote fetal lung maturity. And the last option is for urgent referral for a physician review. So what do you think the correct answer is in this case? You can either unmute yourself and answer, or you can type in the chat box. Correct. So answer C is correct because this patient, as we can see, the diagnosis, firstly, it's important for you to read the question and come to a conclusion. So in this case, what we're dealing with is acute pyelonephrosis, right? And the patient's BP has dropped down to 84/50, which means the patient is going into septic shock. So here your most appropriate action would be to admit in ICU or HDU, which is the first thing that is to be done, and give the patient intravenous antibiotics. Yes, the rest of the options will have to be considered. You may have to do a urinary tract USG. You may eventually have to give steroids to promote lung maturity and obtain a physician review. But the single most appropriate answer for this question is answer C. So now for the exam format, you have each paper with the same number of marks. That means out of the total marks, 50% of the overall marks will be taken from paper 1 and 50% of the overall marks will be taken from paper 2. So no minimum score is required for each paper, and your overall outcome is determined by your combined marks, right? So the overall pass rate is decided by how you score in both the exams, both paper 1 as well as paper 2. So no particular score from each of the papers, but an overall combined score is given. No negative marking. That is why all of the questions should be attempted in both the papers. So how do you tackle the syllabus? So there are around 14 modules, and out of which first 6, as you can see, are in paper 1. So you have module 1, which is anatomy and embryology. Module 2 is physiology. Module 3 is biochemistry. Module 4 is endocrinology. 5 is epidemiology and biostatistics. And module 6 is genetics. Then in part 2, most important of which is clinical management and data interpretation. You have pharmacology, microbiology, immunology, biophysics, and pathology. So basically, we are dealing with all of the basic sciences subjects that we studied during our initial years of MBBS, but most of these are applied to obstetrics and gynecology. So you are dealing with anatomy, which is more related to your obstetrics and gynecology, physiology of the female reproductive system of pregnancy, fetal physiology, and you will see the breakup of all the subjects, which I have explained in the later slides. So distribution of questions, as you can see from paper 1, the chunk of the questions are from endocrinology. So that makes it very important. And you have most of the questions coming from anatomy, as well as subjects like epidemiology and statistics and physiology. All of these become very important. So according to the distribution of questions, we decide on the time or the amount of time that we need to give the distribution for preparing for the exam, right? So the major chunk of the questions, as you can see, are from endocrine and anatomy. So more time has to be given, more time has to be dedicated to these subjects. Paper 2 consists of biophysics, clinical management. So you can see clinical management and data interpretation are forming the chunk of all of the questions in paper 2. And equally important, as you can see, are questions from, you can see, biophysics as well as pathology. So equally important are the pathology as well as smaller subjects like immunology. These should not be ignored. And there are times when the questions from these smaller subjects, they are the deal breakers. Like they'll be deciding whether you pass the overall exam. So none of the modules are to be ignored. Each and every module has to be covered in detail. So SBA paper 1 consists of 100 questions, and the time duration for the first exam, for the first paper, is for 2.5 hours, right? So 150 minutes are given for the overall paper. You have a lunch break, which is approximately an hour. And then you have the second paper, which is again 2.5 hours, which is 150 minutes, consisting of 100 SPAs. So you finish your paper 1, you can take a break, you can freshen up, you can eat. And once you're ready, you can start with the paper 2 exam and finish your exam in the stipulated time. So your exam is conducted at the Pearson Exam Center. This is how it appears. And now we'll be discussing about the subject-wise breakdown of what are the important topics which you have to concentrate on in each module. So in anatomy, most important is you have to know your diagrams. So frequently questions are asked wherein you are given a clinical case scenario and an accompanying diagram will be given with a marking for surface anatomy, and you may have to figure out what is the overlying nerve or vessel or the dermatome or segment, right? So diagrams become very important for anatomy. You have to know the relevant blood supply, the nerve supply, and most importantly, you have to concentrate on the pelvis, the abdomen, the trunk. You also have to study a little bit of neuroanatomy because this is important for you to understand endocrinology and physiology, right? So this is the core important aspects for anatomy. Moving on, for embryology, development of female reproductive system is very important. You frequently get questions on pharyngeal arches and their corresponding derivatives, their corresponding nerve supply and blood supply. Then development of cardiovascular system, urinary system, and GIT is extremely crucial because only when you understand the developmental stages is when you can understand the anomalies and you'll be able to pick up the questions and will be able to answer them correctly, right? So that is how you'll be able to solve clinical case scenarios if your core concepts for developmental embryology is clear. Then development of endocrine system is very important. For microbiology, you may be given pictures to identify like gram staining pictures or pictures of protozoa. You may have to identify fungal hyphae, and certain facts may be given for you to come to a clinical diagnosis. Treatment for microbiological infections is equally important. All sexually transmitted infections, pelvic inflammatory disease, all of the infections related to female reproductive system are equally important. Now for immunology, you have to concentrate on types of immunity, antigen presenting cells, antibodies, what are the type of hypersensitivity reactions, Rh incompatibility is very important, as well as autoimmune diseases. In biochemistry, because the subject is very vast, you have to remember very crucial points. Like for example, for carbohydrates, protein and lipids, you have to know the metabolism, the cell cycles. But amongst the cell cycles, it is important for you to know, like for carbohydrate, for glycolysis, for Krebs cycle, you have to know about the ATP generation. You have to know about the rate limiting enzymes and steps. And that is how the clinical scenarios are derived from. So whatever is relevant to your clinical questions, that corresponding part of biochemistry you have to know. So hemoglobin synthesis and catabolism and related disorders are very important. You have to know about cell signaling. Also, second messengers as well as receptors and coenzyme functions are very important. In biochemistry, we will also be covering about the urea cycle as well as nucleotide synthesis. An important part of biochemistry is also nutrition. So all of your vitamins and their corresponding deficiencies are to be memorized. Now coming to pharmacology, general pharmacology has to be covered. And most importantly, what you have to know are the drugs that are used in gynecology. So you have to know about all the drugs that are safe in pregnancy, what are the categories of drugs, the drugs that are contraindicated in pregnancy. Contraceptive use has to be done thoroughly. So you get a lot of questions from contraceptive practice, and the UK has specific guidelines, the UCMEC criteria, contraceptives. So this is what you have to concentrate on. Now coming to pathology, you have to know about general pathology. You have to know about the cell stages, the adaptation, cellular changes. Also, cell cycles are very important. All of the benign pathologies related to the reproductive system, the gynecological malignancies is very important. And very important are as well the cancers and their staging as well as the management. So coming to physiology, female reproductive system in great detail, male reproductive system as well as you have to know about fetal physiology. Physiological changes in pregnancy are extremely important, and most of the questions for physiological changes are asked. Now in endocrinology, you have to cover placental structure and function. You have to concentrate on the glands like adrenal, thyroid, and pancreas. And you do get a few questions from hypothalamus as well as the pituitary gland and their hormones. Now, in genetics, it's very important to and very scoring to know about and to learn pedigree analysis and to diagnose disorders, genetic disorders, and their inheritance. Single gene disorders as well as chromosomal abnormalities may be given to you as clinical case scenarios. Now, in biophysics, it's important to know a little bit of everything, like about ultrasonography, the few basics, and what we use in clinical practice. So it's not in great detail, but you have to superficially touch on all of these important topics like ultrasonography, X-ray, CT, MRI, the frequencies, how many hertz for transabdominal sonography, transvaginal sonography, what kind of radiation is which is contraindicated in pregnancy, and what are the measures to be taken if the patient is exposed, basics of ECG, and also to be able to diagnose a pathological ECG, laser, ionizing as well as non-ionizing radiation, as well as the basics of electrocautery, which is used in surgical practice. For data interpretation, you will be given lab values, standard lab values. You may be given an anemia profile, and you will be asked to diagnose the type of anemia and the treatment that you will give. You will be given lab values and be asked to identify whether it is impaired glucose tolerance, whether it is diabetes mellitus, whether it is gestational diabetes mellitus. So all of these lab values and charts will be given, and you have to diagnose and manage the condition. Interpretation of arterial blood gas analysis as well as pH for acid-base disorders. Cardiotocography and partogram is very important. It's very crucial, and it forms a major chunk of your clinical management and data interpretation. This is important to know, as on the basis of this, you will be able to solve all of the questions for labor and delivery, as well as for intrapartum monitoring. Subfertility assessment, in this, the WHO standard husband semen analysis report, the partner semen analysis report is very important, and you have to know the criteria by heart for you to diagnose the condition, right? So now we're coming to statistics. So statistics, we all have a fear of biostatistics, I'm sure, right from our MBBS days. But trust me, biostatistics is a very scoring module for your MRCOG Part 1 exam. So you have to know basics of statistics, nothing very complicated. So the types of study, the case control, cohort studies, the advantages of one over the other, all of your screening tests. So being able to calculate sensitivity, specificity, positive and negative predictive values. You have to know about the prevalence as well as the incidence calculation, right? And your basic tests of significance. So now, how do you prepare for MRCOG Part 1, and what are the books to refer? So the RCOG has listed a variety of textbooks for reference, and the curriculum that is given is very vast. So to narrow it down, what you should concentrate on are a couple of guidebooks which you can use as your reference. And more importantly, you should focus on practicing questions. So for practice questions, we do recommend these books. You can pick any of the books for practicing your MCQs. So you have MRCOG Part 1, 400 SPAs, 550 SPAs. You have Andrew Sticer. And for reference, you may use these following textbooks. So you have the Essential Revision Guide by RCOG, which has been recommended. So all of your conceptual learning is based out of this textbook, right? So if you want to clear your concepts, you want an in-detail review of each of the modules, then it has been listed beautifully in this textbook. But this textbook, because it is very vast and the language is very verbose, you need to be able to make notes out of these, right? So making notes out of a conceptual textbook is very important, as you may not be able to revise it before the exam. For something which is handy for revision, you have the Oxford revision notes, and these are given as bullet points, right? So they're given, all of your statistics, numericals, and bullet points are covered. So these books are highly recommended. Special focus, like I said, from paper 1, you have to focus on biostatistics, endocrinology, and genetics. And these are very scoring. They form a major chunk of your exam. For paper 2 point of view, according to me, what is important is for you to know about clinical management and data interpretation. Now, you must be wondering, because we all practice clinical in our clinics, whatever practice we do is according to what is being formulated in our place at our local guidelines, right? So, but this is not the RCOG standard. So whatever protocols that we follow are not usually the ones that are listed by the RCOG. The RCOG is very strict according to their protocols, right? So whenever you manage a question, you shouldn't select the answer that you think is most appropriate according to your knowledge or your practice, but rather The option should be the one that is listed as per the RCOG protocols. So that is why concentrating on this part is very important. Now, how do you pass this exam in one go? To ensure your success, your 100% success in the first attempt, first and foremost, you have to be very determined. You have to be very motivated to give the exam. So frequently people ask whether how much time is usually required to give this exam. So we can't list an approximate time that you require 6 months, 4 months, 3 months. But whatever time you decide, you have to start then and there. So you have to start now. You have to be dedicated. Consistent study over a period of time is more important than enrolling for a course for 6 months and not covering your modules, right? So it is important for you to plan it in such a way that you're able to cover all of your modules in good time, and you're able to at least be able revise 2 to 3 times, right? So you have to adopt a study schedule accordingly. You have to prioritize. Obviously, we know that we're all managing our work as well as balancing studies and home. So it is important for you to dedicate at least a couple of hours every day to your practice and this to your study, which has to be both studying the concepts, revising your concepts, as well as practicing your MCQs. So discussions are very important. You can enroll in a lot of groups and you can discuss, or you can find a study partner, a study peer with whom you can have a daily discussion. Important for MRCOG point of view is to practice your exam questions. So there are a set of certain, like we discussed, important topics from the modules, and you need to be able to practice all of those questions on a regular basis. So solving those questions repeatedly is very important. Practice every day, and most important is to stay motivated. So common reasons on why students fail in the MRCOG exam is mindset issues. They are not focused, they are not determined, they have other issues going on, health issues, multiple factors. So you have to decide a suitable time when you can give this exam with full preparation. Be determined and focused that you are going to, and be positive that you are going to clear this exam in one attempt itself, right? It is not a very difficult exam. It's a standard exam that you will pass with clearing your concepts and with regular practice of questions, right? So it is nothing that is undoable. And I'm sure most of you will clear this exam in the first attempt with determined practice, right? So first is your mindset issue that has to be sorted. You have to be able to have a focused preparation. If your preparation is non-focused, you don't have a study schedule in mind, you haven't adopted a proper technique for revising, reading, making notes, then this is not going to be fruitful. Examination stress, and if you have the wrong strategy for attempting the exam for solving the questions, that may also lead to failure. So what do we recommend? First, you have to read, right? So we've listed the reference books. You have to read them, and it will require time. It will take time for you to read those books, revise those books, make your own notes, revise those notes, and then go back and forth, refer to the practice books. Not all the answers that are listed in the practice question books are up to date. So you may have to go back to your revision guides and to your reference material to check for answers. So all of this will take time. You have to revise. So you have the RCOG e-learning platform. You have to focus on the last few years, at least 5 years recall, as well as there is an option for going for online assessments and online practice tests. And then you have to give the exam. You have to at least attempt mock papers for you to be able to gauge how to manage your time in the final exam. So since all of this will require a lot of effort on your part, we have simplified this process and made it very palatable for you in a very structured format. So the course that we have launched, this is what it comprises of. You get summarized content, right? So all of the modules that we discussed, they are quite extensive. They have been encapsulated into video lectures, and that is very time saving for you. So once you go through these lectures, and if you make your notes alongside, or even if you refer to the PDF that is given to you, all of that will be very time saving. You will be able to memorize a lot of data in a very short span of time. The concepts have been simplified, like I said, and you have tables, flowcharts, right? You have diagrams for you to memorize all of the data very easily. Revision of the modules is conducted by having daily your MCQ discussions. You can post all of your queries on the groups. You're given topic-wise or module-wise tests. So after completion of each module, you undergo a test of almost 100 questions, which gives you good practice and a revision of all your concepts. Additional information and additional updates are added onto your questions so that You are updated with all of the latest guidelines and protocols, right? And your recalls are simultaneously also covered. So what we offer is a complete comprehensive learning program on our platform. So like we said, the core, the base of your learning, once you enroll for our schedule, once you enroll for the coaching, is your video sessions, right? So you have live video sessions wherein all of your concepts are discussed, as well as the same is provided to you in PDF format. We also have live sessions on certain important topics, as well as core MCQs, key MCQs, which will help you cover the entire topic, are also discussed. You have module-wise or topic-wise tests. We have discussion groups on Telegram as well as WhatsApp, wherein all your queries can be covered. Recalls are discussed, as well as at the final end of the of your last 2 months of your just before your exam, we'll be giving you a mock test which simulates the final MRCOG Part 1 exam. So this is the summary of how you should be going about your preparation, what your schedule should be like, what sources you should refer, and whether or not you should join coaching, and how to attempt the exam in a proper way so that you ensure that you get success in your first attempt. So with this, I conclude my webinar, and I'm open to any questions. I'll be pleased to take your questions now. So scope of MRCOG, I've been asked this question in the chat box. So like I said, for ones who want to continue their training in the United Kingdom, it is very important for you to clear their licensing exam. So that is why MRCOG is important. But even for others who do not plan on settling there, who do not plan on working in the NHS, it is very important for you to appear for this exam. It is an internationally recognized qualification. It has a lot of credibility and a lot of job opportunities in various other countries. So like we discussed, this is for people who have finished their MBBS and are looking to pursue their training in obstetrics and gynecology in UK, as well as people who have finished their qualification in other countries and are looking for better degree and better opportunities worldwide. So the details, we'll be launching our course soon, and the details of the course will be shared with you all on the WhatsApp as well as Telegram groups. And you can contact on any of the numbers that are listed, as well as on the website and email. And we'll be giving you the details of the course later on. So with this, I conclude my session. If you all have any questions, please, you can put your questions in the WhatsApp group as well as the Telegram group, and you can contact the numbers that are listed. And I hope to see you all in the course for the July 2025 exam. Thank you.